Hello, uh, good evening. It's 6:56 p.m. So let me give 4 minutes, and at 7 p.m. on the dot, I am going to start. All right. Otherwise, karibuni to the session. Let me add my slides. Hello, good evening. I hope you've been well, and I hope that October is being good to you. Otherwise, I just want to welcome you to the session. It's October Mental Health Awareness session. It's good to have you this evening, and I hope that this session is going to be impactful, it's going to be informative, and it is going to help you become more self aware, and you are going also to help people in your circles. All right. So, like I said earlier, this month, okay, earlier in my invitation, this month we are going to talk about cluster A of the personality disorders. So, yeah, I hope you are ready to learn about these personality disorders. I'm looking forward to having us able to understand the different diagnostic criteria all right, for some of these disorders that we're going to discuss tonight, so that you don't say that I have a certain personality disorder, yet you've not verified whether you meet the criteria. So that's the importance of this night. And then also to be able to understand, if for instance I have this disorder, how is it affecting my self-awareness? Okay, so yeah, looking forward to having an insightful session with you. Let's get right into it. Okay, so today we are understanding cluster A personality disorders. So what are personality disorders? For every of these sessions, I've been beginning by asking us what are personality disorders. So that we don't forget, Niskotu, I am saying personality disorders, yet they are not known to us. So personality disorders are an enduring pattern of inner experience and behavior that deviates markedly from the expectations of the individual's culture. It is pervasive and inflexible and has an onset in adolescence or early adulthood and is stable over time, and it leads to distress or impairment. So one thing I want you to understand is that it has to be an enduring pattern. That means that her body, like it doesn't change, all right? So, or like it's a cycle that it can actually be predicted, that at a certain time this person I normally behave this way, or this person normally behaves this way, or during certain places this person normally behaves this way. That's what I mean by an enduring pattern. So you can even predict it. Okay, so it doesn't fluctuate that you get confused to say, maybe this time is like this, so that it doesn't confuse even how you diagnose it. It is an enduring pattern. It's an enduring pattern. So if someone is used to being violent, all right, that is the enduring pattern. You know for sure, if I expose him to certain people or a certain place or a certain thing, I know it will evoke the violence. Okay, so that is what we mean by an enduring pattern of inner experience or behavior that deviates markedly from the expectations of the individual's culture. Now, probably in our culture, violence is like it's absurd, like it's unheard of. But in another culture, probably it's accepted. Like the way when we used to grow up in some cultures, we used to be told that beating the wife is such a good thing. It shows that you love them. So that's why I'm saying that sometimes it depends on an individual's culture. So whatever this person is doing, or whatever this pattern that we've talked about, whatever it is, it has to deviate from, like it goes out of the expectations of that culture, of that individual. Okay, so it is pervasive and inflexible, and it has an onset in adolescence and early adulthood, and is stable over time. Now let me say something about having an onset in adolescence or early adulthood. It's very important for us to know that some of these disorders, their onset is childhood, but some of them, like these personality disorders, mental health disorders are categorized into different clusters. So they begin with neurodevelopmental disorders. So those are the disorders that come up when your child is, when you are born. Let me not even talk about us when we were born, and as we were starting to, to develop, to grow, there are things that used to develop, like, at this month a child is supposed to sit, at this month a child is supposed to talk, at this month a child is supposed to be walking. And then now in neurodevelopmental disorders, you find that some of those developmental stages are not achieved. Okay, so that's the onset of those disorders, which we will look at in the future, like for the neurodevelopmental disorders, mental health disorders. But this time round, we've been looking at personality disorders. And for most personality disorders, their onset are during the adolescence or early adulthood. Okay. Other disorders that their onset could be during adolescence or early adulthood are like depression and anxiety. It's so hard to say a child, a 3-year-old child or a 4-year-old child is going through anxiety or depression, you know. But for an adolescent, it's easier to diagnose such a disorder, right? Or illness, such an illness, because its onset is at adolescence and it is easy to diagnose at that point. Okay. But for the developmental disorders, they're like, ADHD, autism, and many other learning disorders, like, and we are going to discuss them in the future. All right. So these ones, their onset are either in adolescence or early adulthood. So if you're a child in some of these disorders, today we are going to talk about three disorders that I talked about in my invitation: paranoid, schizoid, and schizotypal. So if there are onset of some of these characteristics that we are going to talk about tonight, if they started when they were so young, like these are behaviors that you could sense from that time, probably it's not it's not paranoid disorder or it's not schizoid disorder. But don't worry, we are going to look at it and I'm going to explain more as we get there. All right. So it leads to distress and impairment. And like I said, all of these disorders, they affect our behaviors, they affect our feelings, and they affect our attitudes. If you go back to the former videos that I've done, you will see what behaviors are, what feelings are, and what attitudes are, especially the January one. You will be able to get all this definition and you'll understand how this what I'm talking about. All right. So cluster A disorders are paranoid personality disorder, which is a pattern. You see again the word pattern. It's a pattern of distrust and suspiciousness such that others' motives are interpreted as malevolent or malicious. Then there is schizoid personality disorder, which is a pattern of detachment from social relationships and a restricted range of emotional expression. Okay. And then there is schizotypal personality disorder, which is a pattern of acute discomfort in close relationships, cognitive or perceptual distortions, and uh, eccentric eccentricities of behaviors. Okay. Now, these disorders, we normally call them odd or eccentric behaviors. You know why? Because like personality disorders, we have seen it's a pattern of distrust and suspiciousness. So that's so odd that I can meet someone, I am very like out of my good heart. We were taking a cup of tea, probably it's my colleague in the office, and I offer them a snack and they're like, no, thank you. You tell them, but you've not had anything, we can share. After all, I've carried too much. And they're like, no, thank you. Deep within, I'm not saying that everyone who says no, thank you, this is the reason why, but for most of them, deep within, probably, I mean, for not most of them, for a person with paranoid personality disorder, deep within, they're saying, what if this person has kept a drug in it or something? You know, the way we are Africans, we believe in juju, and it's going to make me not of sound mind at work, and soon I'll lose my job, so I'm not going to take it. Okay. So suspicious, you look at other people's motives and you interpret it as suspicious. Or you meet someone and they're looking at you and they're smiling, they have no ill intention completely, it's just their nature. Like for instance, yours truly, like if you're coming this way and I'm coming this way, not unless it's in the street of Nairobi, but probably in a work environment or in a church environment or in a neighborhood environment or in our apartment, if I see you, I'll be smiling at you when we are approaching each other. And it is because I just find it like a good thing to do. But for someone with paranoid personality disorder, they wonder, why was this person smiling at me? What are they plotting? What did they see on my face or something? That's paranoid. And then for schizoid, is a pattern of detachment from social relationships and a restricted range of emotional expression. Now, these people, they are odd in the sense that they tend to disconnect from social relationships. They're not fond of social relationships, okay? And then also they have a restricted range of emotional expression. So you'd find these are guys that you sit, all of you guys are laughing, you're having a good time, but they're just there, they're withdrawn, they're not talking, they're not expressing. You don't know if they're happy or if they are sad, because to them, number one, being found in a social setting is the most annoying thing ever. Okay, so that's schizoid. These are people who are detached from social relationships and they don't express their emotional expressions. And then there is schizotypal. I know as I'm saying this, there are people who are crossing your mind, but don't diagnose them first until we go through the diagnostic criteria. All right. We have the schizotypal personality disorder, which is a pattern of acute discomfort in close relationships, cognitive or perceptual distortions, and eccentricities of behavior. So for schizotypal personality disorder, it's a pattern of acute discomfort in close relationships. So these ones, somehow they are similar to schizoid personality disorder, but now the issue with theirs is that it's cognitive in nature. So probably a certain part of the brain did not develop well while they were being formed in their mother's womb, or during the developmental early developmental stages, like I talked about. So for schizotypal, it's acute discomfort in close relationships, cognitive or perceptual distortions, and eccentricities of behavior. So these are guys that can even throw a seat at you or something, or a sharp object if they are mad or something. But we are going to look at their diagnostic criteria. So what is the impact of these disorders on our self awareness? We're going to look at them in depth in each personality disorder, but for now, let me just mention that the most general thing is that they affect our self image, and they which can lead to misunderstanding of personal emotions. Number two, they lead to difficulty in recognizing the impact of their behavior on others. So someone will do something and they don't even realize that they have hurt you, or they have disrespected you, because according to them, that's just, it's normal. Actually, the rest of us, we are the ones who are abnormal. They wonder, how are you fitting in so well in a social relationship? Like, I mean, in a social setup, you are so comfortable, you are having the time of your life. They wonder how. Yes, so they have difficulty in recognizing the impact of their behavior on others, and then challenges in forming coherent sense of identity. So this also affects how they identify themselves, how their self-image, their self-perception, their self-consciousness. It affects it. It affects their sense of identity. If you want to learn more about the sense of identity, you can go back to our edition on Feb. I did a very detailed explanation on the components of self-awareness, and some of these identities, you are going to find them in that session. All right. And then basically, these disorders, they affect how we think, how we feel, and how we behave. Now, don't forget that I said each and every one of us, we have one of these disorders. If you are not in cluster A, you will be in cluster B. If you're not in cluster B, you'll be in cluster C. Either you have just discovered today that you have those disorders, or you discovered Kitambo and you're a recovering. Okay, you're in your journey. Like me, I'm in my journey. I have one of these disorders and we did it. Huh? And I was laughing all through the sessions because I could see myself so much in it. But the good thing is, I realized it and I started working on it. I have not yet recovered completely. I'm still in my treatment. So I'm saying either you've just realized or you don't even know. Let's start with either you don't know Number two, either you've just realized, or number three, you are working on it and you're getting treatment. Probably you've properly been treated and you're doing very much okay, or you're still in the process of treatment, like me. All right. So they affect how we think, we feel, and we behave. And they distorted self-image, distorted sense of identity, and not recognizing the impact that our behaviors have on other people. Now, paranoid personality disorder. What is this? I have already said it's mostly this. Whew, it's it's categorized by distrust and suspiciousness. Okay, so everything someone does is suspicious to you. The way they look at you is suspicious. Allow me to unplug my charger. Yeah, it's suspicious to you, everything. So why? What are the causes of paranoid personality disorder? Number one, genetic predisposition. So if someone in your lineage, family lineage, had this disorder, it could you could have inherited it. Number two, traumatic experiences. So if probably, like the illustration I gave earlier, someone is offering you a snack for tea, probably in the past, even when you were young, in adolescence, or maybe in your primary school, someone offered you a snack and it was it was spiced, or it was, what do they call it? We have called it spice. I hope you understand spice. Like they had kept something that will alter maybe your, either to kill you, or to alter your behaviors, or to alter your intelligence or something. Those things that people normally say, and it is true, by the way. We have seen it happening to people, and it is probably true. So traumatic experiences, such as those, it can lead to paranoid personality disorder. And then also another thing is dysfunctional upbringing. When you were growing up, your mom always used to say, don't go and eat from your neighbor's house. They might, they might spice your drink. They might do what, spike. Oh, it's spike, not spice. Sorry. Spike your drinks. They might do what? They normally envy us. This community, people look at us and they really envy us. You don't know. If you meet someone on the street and they're staring at you, run very fast and come and tell me, because we need to do a cleansing. All those things. Dysfunctional upbringing. So because you're brought up listening to such sort of things, or watching such sorts of things, or just something, you might develop this personality disorder. So I've said either because of genetic predisposition, traumatic experiences, or dysfunctional upbringing. Now, this is the most important part. And the reason why I normally do these disorders is because in our society right now, as people are becoming more informed about mental health issues, you find now, eh, I, I I meet people, and even sometimes I have clients who come and they tell me, for instance, me, I have paranoid personality disorders. And then you ask them why, and then they'll mention either one or two of these symptoms here. And to them, they've concluded that they have that disorder. Now, if today I have a running stomach, probably it's because I had some food poisoning and I have a running stomach. If I go to the hospital and tell the doctor that I have a running stomach, so I have cholera, I mean, it's okay, it's one of the symptoms, but how sure are you? Or I had a very high fever or something, and I had also some headaches and I was sweating, and then I go to the hospital and they tell the doctor, hey, Ebu check, I have TB. And they're like, okay, fine, that's just one symptom of all the other symptoms that we are supposed to look at. So that's the same thing as mental health illnesses. There are so many other symptoms that we need to look at before we diagnose. So these are the symptoms that we need to look at before we diagnose someone with paranoid personality disorder. And even today, after you've done this session with me, please don't go diagnosing people because you've seen the criteria. They need to be diagnosed by a professional. A psychologist can diagnose, but as much as I diagnose, I'm not even allowed to treat them, not unless I am providing psychotherapy. The next step should be sending them to a psychiatrist who will confirm my diagnosis, and probably if there is need for, administering medication and all that, the psychiatrist can do that. So you see, even me in my line of work, when it comes to diagnosis and some of these disorders, there is a very huge line drawn for me, so that I don't cross that line, so that we don't cause damage. Okay. Anywho, so the diagnostic criteria is: one, a pervasive distrust and suspiciousness of others, such that their motives are interpreted as malevolent, which I've said is malicious, beginning by early adulthood and present in a variety of contexts, as indicated by 4 or more of the following. Now, like I've said, please, if the person, or even if it's you and you have only 2 of these symptoms, don't diagnose yourself with paranoid personality disorder. It could be something else, and that's why you need a professional to walk through this with you, so that they can tell you, yeah, I know 2 symptoms, that could be that. And if you don't take care, you can develop many more, but it is not paranoid personality disorder, because for this one, you have to meet at least 4. Yani kan kidogo sana, 4 or more of these 7 that I'll list. Number 1, if a person suspects without sufficient basis that others are exploiting, harming, or deceiving him or her. Number 2, I believe these are self-explanatory, so I'll just read through them. I've done a lot of explanation since I started. So for the criteria, I'll just read through them. And then if you don't understand the criteria, trust me, it's because maybe nakimbia. If you just go through this video again and you go through it pole pole, you'll understand the criteria, because it's simple. I went through it as I was preparing, and yes, I can verify. But in case you have any question, you can type it in the chat box, and I'll be more than willing to respond to it, and even reach out if possible, if need be, that is. Anyway, suspects without sufficient basis that others are exploiting, harming, or deceiving him or her. Number 2 is preoccupied with unjustified doubts about the loyalty or trustworthiness of friends or associates. Is reluctant to confide in others because of unwarranted fear that the information will be used maliciously against him or her. I hope those 3 you've understood. You suspect others without basis. So Sarah wanted to spike my drink and you don't have any basis. Is preoccupied with unjustified doubts about the loyalty or trustworthy of friends and associates. It can be even family. You're just like, yeah, I doubt. This person doesn't love me. They're always plotting something against me, such kind of things. And then, and it is unjustified doubts. Underline that. And then is reluctant to confide in others because they fear if I tell them that something, they're going, even right now, as I'm talking about some people, as I'm talking about people coming to talk to me, so that I may walk this journey with them, that a person with paranoid personality disorder is just saying, hey, Sarah is looking for information so that she can implicate me with, or something like that. And then reads hidden meaning or threatening meanings into benign remarks or events. Persistently bears grudges, i.e. unforgiving of insults, injuries, or slights, perceives attacks on his or her character or reputation that are not apparent or to others, and is quick to react angrily or to counterattack. Has recurrent suspicions without justification regarding fidelity of spouse or sexual partner. That one we know too well. All right. But now for this one, it has to be very persistent. Of course, for partners, once in a while I hope right now we have matured, but once in a while they want to, go into other people's, into their partner's phones and all that. But for someone with paranoid personality disorder, that's all they think about. These are the people who are hacking their spouse's phones, okay? So that they can see all their engagements and all that. Anyway, then so for criteria A, it is 4 or more of those symptoms, okay? And then for criteria B, does not occur exclusively during the course of schizophrenia, bipolar disorder or depressive disorder with psychotic features or another psychotic disorder and is not attributable, my lawyer people, leave me alone, to the physiological effects of other medical conditions. Now, what this simply means is criteria A, this person could come to me and probably they have 4 or more of these disorders. That's okay. But now, what will ascertain whether this is true or not that they are suffering from paranoid personality disorder is this criteria B. Because if it is during another disorder like bipolar disorder or schizophrenia, which we are going to talk about in the future, so that doesn't warrant that this person is going through paranoid personality disorder. Now, this could be as a result of that other disorder that they are having. So I need to ascertain that this person presenting themselves to me doesn't have these other disorders. I hope I'm clear. I am trying to think of an example of another physiological disease that we can talk about. Or probably so it's like going to the hospital the same way that I've told you. Probably you first went there because you had malaria and you had a running stomach. And then as it continues to persist, you go to another hospital and you tell those guys, hey guys, please test me for cholera because I am having a running stomach. And it is because you realized the treatment that you are given for malaria bado haijafanya kazi, and you went back to that hospital and they told you finish first your dosage and then you'll come back and tell us if there is no change. So ujanja wetu kama wanadamu, you go to another facility and you tell them, I think I might be having this other disorder. So if those guys are not keen to check and know, have you been diagnosed with another illness, as in before this, if they don't do all the tests, then they just go by what you've told them or just that one symptom, they can diagnose you as having cholera. Kumbe it's because you had malaria and it was just you were not even halfway the dose and you had not yet recovered. I hope that point is understood. So even if you've met 4 or more of of criteria A, criteria B might rule out, because if you have another disorder like we've said bipolar or schizophrenia or any other depressive disorder, then it might rule out that you have paranoid personality disorder. Either way, look at those symptoms and 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 uh, and evaluate whether you've had this from probably adolescence up to now, in your early adulthood or in your adulthood. Has it been persistent for more of this? It could be that you have a paranoid personality disorder. So how does it affect our self-awareness? Hey, this font now go kill me. I can't even see it properly. I know it's my work. I'm sorry. Let me enlarge. Yes, now I can see. Effects on self-awareness. Individuals may not be able to build or maintain healthy relationships because of their distorted view of reality and recognition of their emotions and those of others. Hey, hiyo kizungu yangu. And recognition of theirs and others' emotion. It's okay. So effects on self-awareness, they might not be able to build healthy relationships. And also, they might build, but they might not be able to maintain because of paranoid personality disorders. And then also, they have a hard time recognizing their emotions and those of others. So they might hurt you and they don't even realize. And then we have schizoid personality disorder. As I have explained earlier, this is detachment from social relationships and restricted emotional expressions. So what are the causes? Genetic factors, like I've said, it might be inherited. So then there is childhood neglect. I hope you understand that when you are being brought up, they never used to pay attention to your needs and all that. And then there is emotional detachment. If you're brought up by parents who also did not value emotional attachment, and so they taught you to be detached, or you went to a school, probably at home you had emotional attachment, but you went to a school or you encountered people as you're growing up, especially in your early adulthood, just after adolescence or teenagehood, And then that's around 19 years, like I said in another episode, around 19 years to 24 years, you started having emotional detachment because people around you, they used to neglect you for one reason or another. Today I was listening to a certain whatever people, and they were talking about how people in school used to, isolate us because of various reasons. Oh, umetoka ushago. Me, I used to be called Virenje when they realized I'm Luya or something, and I used to come from Kondani, and I didn't have proper English by then. I still don't. I am trying. And then so many things, and people would isolate you, or you'd be monolized and bullied. That's emotional detachment, and it can lead to schizoid personality disorders. However, let's look at the diagnostic criteria. So criteria a pervasive pattern of detachment from social relationships and a restricted relationship with others. I'm so sorry about that. I hope you can now hear me. Heartless, heartfelt, sorry, not heartless, heartfelt vibes. Thank you for joining. I'm sorry. I have been having a full day, like a full day engagement on the internet. So I'm using a MiFi. It has heated because it's been on since morning. So nimeenda kamejam, kakasema my friend, weka peke yako hapo, because I think it has really been used. But I hope you can hear me now. Could you kindly confirm if you can get me? I am sorry for that. I am so sorry for that. Let me try to. Thank you, Lydia. Thank you. Thank you so much. Oh my, that's a pleasant surprise. Probably that happened so that I would know you're in the session. Thank you. Thank you so much. Okay, let me add my presentation again now that it disappeared. Hata nimetense. Let me present here. Present, share screen. Busy schedules, but we are managing. So yeah, share screen. Oh my, what's happening? Okay. I need to calm down because now hadi nachanganyikiwa. I cannot see my presentation. It has just disappeared from my, Cancel, present, or slides. What was I? Schizoid. Um, I hope you can see the slides. I hope they are back. Because this face of mine haitakusaidia sana as the slides. So let's do this. Yeah, so I was saying that this individual has to meet criteria A, and the onset is at early adulthood. And actually today I was somewhere and someone was asking me about some, and they were asking me about ADHD, and I was telling them ADHD, you cannot diagnose it at adulthood. It has to start from, you know, from from childhood. So for this one, if its onset is at adolescence, then it has to meet other criteria before, criterion as English would say, before you diagnose it as schizoid personality disorder. Anyway, let's go on. And present in a variety of contexts as indicated by four or more of the following. Four or more again. So again, they are self-explanatory. So one, neither desires or enjoys close relationships, including being part of a family. Almost always chooses solitary activities, has little, if any, interest in having sexual experiences with another person, takes pleasure in few, if any, activities. Five, lacks close friends or confidants other than first degree relatives, who also we've seen in one that sometimes they can even be distant even to their first degree relatives. And these guys, because I say this personality is for the odd and eccentric, you can find that if they were growing up and they found another kid who looks like them, now that's their close confidant. But anyway, I was in number 5. Number 6, appears indifferent to the praise or criticism of others, shows emotional coldness, detachment, or flattened affectivity. Okay, shows emotional coldness, detachment, or flattened. Sorry, I was checking this thing. Isiko imeenda tena. Flattened affectivity. So, criteria B does not occur exclusively during the course of schizophrenia, bipolar disorder, or depressive disorder with psychotic features, another psychotic disorder, or autism, or ASD, and is not attributable to the psychological effects of other medical conditions. Okay, so I've explained a lot in the first disorder, so you can just go through the symptoms again. You'll be able to understand, but I hope you've understood. These guys are odd kabisa, they are detached kabisa, and it could even be from their own families. So treatment: psychotherapy, which is what I offer. You talk, you come, you talk after I diagnose you with this disorder. And then if it's too hard that psychotherapy cannot work, that it has really affected your behavior, feelings, and attitude, I might have to refer you to a psychiatrist who can now prescribe medication such as antidepressants and antipsychotics. And then I can also help you with social skills training. Yani nikufunze kukaa na watu na tabia za watu, because we've seen also that these people, their behavior is, they are not behaving according to our culture as their culture could expect them to behave. So how does this disorder impact an individual's self-awareness? Number one, okay, not number one, individuals with SPD, let me call it that way, may have difficulty understanding their own emotions or the emotions of others. They may also be emotionally detached, making it difficult to form meaningful connections with others. And my friends, I told you that mental health, it is about relating well with others. And also our existence here on earth, what can you do without people? We all need each other. So for such a person, it will affect their self-awareness such that they might not even be able to know themselves, to understand themselves properly. and then also they might not be able to, to form meaningful connections. And then the last that we are going to do tonight, schizotypal personality disorders. This is acute discomfort in close relationships, cognitive or perceptual distortions, and eccentricities of behavior. So that's how I explained when we were starting. So I'll just go ahead. Causes, genetic factors, childhood trauma, and dysfunctional family environments, which I have also explained as we were starting. All right, in the first disorder. So allow me not to go through that again. So, what's the diagnostic criteria? A pervasive pattern of social and interpersonal deficits marked by acute discomfort with and reduced capacity for close relationships, as well as cognitive or perceptual distortions and eccentricities of behavior or odd behavior, beginning by early adulthood and present in a variety of contexts, as indicated by five or more. For schizoid, we said four or more. For paranoid, we said four or more. For paranoid, we said onset is adolescence or early adulthood. For schizoid, we said early adulthood. And now for this one, schizotypal, we are seeing it early adulthood as well. So ideas of reference, excluding delusions of reference. So this means that these people, and especially this disorder is mostly because of the genetic factors or genetic predisposition. So if their brain did not mature properly, then that could be a very big reason why these individuals, as in that could be a very major characteristics of these individuals. All right, so there is odd beliefs or magical thinking that influences behavior and is consistent with subcultural norms, e.g. superstitiousness, belief in cleo, telepathy, or the sixth sense in children and adolescents, bizarre fantasies or preoccupations. We know these superstitions, we know these funny things people are believing in even right now. We know the conversation that is going around right now about the full moon and all those things. Some of these things are what I'm talking about, but I hope you understand. And telepathy. Now, for the schizotypal personality disorder, they are so much engrossed into these things. As we normally just say them, stories are superstitious. At one point, all of us have been, you know, but or even ideas of reference, all those things. At one point, we have been, but for these ones, it's like who they are, that their life is based on these things, okay, and bizarre fantasies. And then number three, unusual perceptual experiences, including bodily illusions, okay. Number four, odd thinking and speech, e.g., vague, circumstantial, metaphorical, over elaborate, or stereotyped. So odd thinking and speech, the way they talk, the way they think, their attitude has been affected, like I said earlier. And then suspiciousness or paranoid ideation, and that's what we have also seen as part of ideas of reference. And then inappropriate or constricted effects, okay. Behavior or appearance that is odd, eccentric, or peculiar. Lack of close friends or confidants others than first degree, okay, lack of close friends or confidants other than the first degree relatives, you hear. And then excessive social anxiety that does not diminish with familiarity and tends to be associated with paranoid fears rather than negative judgments about self. Excessive social anxiety that does not diminish with familiarity. So social anxiety, I talked about social anxiety in our first session in January, but let me just touch on it kidogo too. That's why you see why it doesn't diminish. So social anxiety is people who fear interactions, like being exposed in a social setting. These are guys who can even fear going to the shop because they're going to meet people. And I've made such, and trust you me, I have, and I know that. And it is bad. It is so bad because it can even restrict their ability to work, to go to school, because they have social anxiety. And we all have social anxiety at some point. But what happens is, for these individuals, if it's persistent, like haishi, even if I have social anxiety because of a certain setup, but the more you expose me to it, the more I go easing up, nanazoea, and I am okay. But for these ones, even after trying so much to expose them, to help them to understand there is nothing wrong with being exposed in a social setting and all those things, they are still having social anxiety that is not diminishing. So, and it is associated with paranoid fears rather than negative judgments about self. So, criteria B. So probably in A they have 5 or more of these ones. So you've seen they have listed 9. So any 5 of the 9. But in criteria B, it does not occur the way I explained in the other disorders. It does not occur during a schizophrenia, bipolar, or depressive disorder with psychotic features. I've already explained that. So square, some of those characteristics have come in because, or some of those symptoms have come in because of they already have another underlying disorder. So treatment, psychotherapy, okay, like I said, like what I offer. But ikishindikana, because it comes a time, if now these behaviors are, there are some people like this social anxiety, they can have this, it can really affect the emotions until if you expose them to a social setting, they just collapse, or their behavior when they get outside and people are looking at them, they just go through it. Because we've seen these guys, they are odd and they do not, so to them they will go abusing everyone along the way. And even if you bring them to me for psychotherapy, they just look at me and they're like, this person, why did they bring me here? And they start abusing me or trying to fight me or something. So psychotherapy won't work until they go for medication, antipsychotics. Then after they've taken medication and now they're in a calm state that we can talk, they come for psychotherapy. I would give a story about this, but time does not allow me. But let me tell you, I've ever encountered, you know, this kind of violence. And you see, I'm just a baby girl, small body, small voice, as in, you don't know what to do in such a setup. But if you have people to support you and take these people for psychiatric care, it helps. And then there is social skills training, ufunze watu kukaa na watu. So how does this impact their self-awareness or our self-awareness? Because like I've said, these are disorders that we all have. We all have. Today, probably you are not in paranoid, you might be in schizoid, or you might be in schizotypal. Or even if you're not in cluster A, you might be in cluster C or B, or yes, cluster C or B, the ones that we have already discussed. So how does it affect their self-awareness? Number one, or individuals with this disorder may have distorted view of reality, okay, leading to difficulty in recognizing their own emotions or the emotions of others. And they may also have unusual beliefs or magical thinking, which can further impair their self-awareness. So basically, for all these 3 disorders, they affect how they relate with others, and then it just brings them out of reality, like they're not in touch with reality. So they might end up being in just their own world. And sadly to say, some of these disorders that we have discussed today, kids who have this disorder, probably adolescents or even early adulthood, they're the ones who, like, I think there's a movie I watched or something, I cannot recall well, but they are the ones who cause disasters such as the Boston bombing, or those high school shootouts that we see in the US and all that. And of course, here in Kenya, there must be some other 2 incidences, although because mental health ndio inaanza kupik, and I have not encountered any specifically, but you'd find there young adults who have these disorders, and because it is not being treated, they end up doing some of those things that I'm talking about. They are not, to them it's nothing. After all, they don't have social relations, so there's nothing wrong with shooting people. There's nothing wrong with starting a fire. There's nothing wrong with bombing, you know. To them, it's just okay. So they really need help. Okay, and they also need someone to guide them and to help them become self-aware so that they can have the knowledge that yes, I may be having this disorder, but I know how I can manage it, and I can still cope with the stresses of life. I can still be effective in my day-to-day activities. I can still relate well with others, and I can still have an impact in my community, because that's what mental health is, and that's what self-awareness covers. That's the end of my presentation tonight. uh, if we have any question, feel free to ask before I end the session. So I feel like the most important thing is just to understand that it's not good to diagnose ourselves. We have to know the criteria, and we also need a professional to help us walk through any symptoms. Even if, for instance, you have 2 or 3 of the symptoms that I've talked about, you might not be having paranoid personality disorders or schizoid or schizotypal, or even the others that we discussed, like borderline, antisocial, narcissists. You just have 2 or 3 of those symptoms. Yes, you might not have that disorder, but those symptoms, you need to get over them. Some you can do them without psychotherapy, without a professional, but some you need a professional to walk you through them. And like I said, so that you may be able to cope with the challenges that come along such symptoms. Okay. And then also you may be able to be effective in your day-to-day activities. You may be able to relate well with others, and that you may be able to have an impact at the end of the day. So if there's no more question, I am so grateful. I normally use a certain, I'm not, I know you guys are using YouTube, but for me, I am using another platform. So I might not know who is there until you type in the chat box. And I might not know the exact number of people. You know, after I'm done in this with the session. So otherwise, for Lydia and everyone else who's in the session, I am so grateful. I am so grateful. Thank you for making time to attend the session. Next month, we'll be concluding. I'll be doing a summary of the self-awareness, whatever. All right, in November, that's what I'll be doing. A summary of the personality disorders and how they relate with our self-awareness. I know za leo zimekuwa deep, the personality disorders, but the ones that we did in cluster C and B, they were a bit relatable with our day-to-day activities and a bit common with who we are. But so I'll be doing a summary, and I'll be welcoming questions. And then in December, as we'll be winding up the year, I'll be concluding now on self-awareness kabisa, and I'll be talking about the different stages that we might be in and how they relate to our self-awareness journey. And mind you, in Feb, when we were starting this series, I said that self-awareness is a continuous journey. So even my parents, who are 60-something years, they're still in their self-awareness journey, and I am always poking them here and there. So yeah, it's a journey, but it's important to understand, because the journey that I'm in as a young adult is not the same journey that an adolescent is in their self-awareness journey, and it is not the same as a retired person is in. Okay. So I'll help us understand those needs, and then we'll be done with this series of self-awareness. The recordings are available, the notes are available. You can always reach out and I'll share. And then also, I am willing to offer therapy sessions to anyone who's available. Don't fear about the charges. I know in Kenya, when we hear therapy sessions, yani una tends to we kuja tuonge. There's nothing, I don't want to say I won't charge you, but again, I'm not saying that I'll charge you. We kuja tuonge, and then we will see. Okay, it depends. It really, really depends. But I wouldn't prioritize my, my well-being over yours. Well-being mine financially. God always comes through, but I would always do what I need to do to help you in your mental well-being journey. And if it's something that I cannot do, I will always connect you to the relevant, you know, relevant people to help you. Otherwise, thank you. If there's no question or comment, allow me to end the session. Bye.